Good afternoon. Thank you for joining my presentation. As I mentioned earlier, my name is Oluwatosin Jegede, a doctoral candidate from the University of California in San Diego. I'm presenting the findings of the modeling analysis to quantify the contribution of fentanyl to non-fatal and fatal overdoses among the people who inject drugs in San Diego between 2020 and 2024. On this slide, you also see the names of the co-authors and their affiliation. As we already know, opioid overdoses are driven by the toxic unregulated drug supply. However, opioid overdose is a major public health crisis in the United States. San Diego, being located at the boundary of the United States and Mexico, is a route for trafficking illicit drugs, making it a critical site for understanding fentanyl's role in overdose crisis. Longitudinal cohort studies are very good ways to understand the changes in opioid use patterns and also the relationship between opioid use and, in this particular scenario, fentanyl and overdoses. In addition, dynamic modeling allows for the estimation of fentanyl's contribution to overdose trends at the population level, making this study particularly relevant, as I will describe shortly. In San Diego County, overdose death has evolved over the years, with a marked increase between 2020 and 2024, the period overlapping with the COVID-19 pandemic. And this is due to limited access to harm reduction services despite ongoing drug use. As a result, and as shown on this slide, you will see that the number of overdose deaths more than doubled during the pandemic, increasing from about 400 in 2019 to close to 1,000 in 2021. Therefore, we decided, and as we found very relevant, to study and quantify the contribution of fentanyl to non-fatal and fatal overdoses among the people who inject drugs in San Diego County between 2020 and 2024. The parameters used for this model were derived from the analysis of a longitudinal study named La Frontera. It's a prospective cohort of the people who inject drugs in San Diego, in California, and Tijuana, Mexico, making it a binational study. Participants were recruited between 2020 and 2021, and they were followed up every 6 months until 2025. For the modeling analysis, we focused on participants who resided in San Diego throughout the study and follow-up period, because the drug market and harm reduction services are different between the two countries. The analysis of the La Frontera cohort study shows that the percentage of participants who reported fentanyl use increased from 51% between 2020 and 2021 to 62.4% in 2024. The experience of non-fatal overdoses reduced from 38.5% to 19.1% among the participants who used fentanyl, and increased from 6% to 9.8% among those who do not use fentanyl. However, if you look at this slide carefully, you will find that the proportions experiencing overdoses are still higher among those using fentanyl compared to those who do not use fentanyl. This finding is also corroborated by the multivariable Poisson regression, as shown on this table, which shows that the risk of non-fatal overdoses was about 6 times higher in between 2020 and 2021, and 4 times higher in 2023. If you wish to know more about the results of this La Frontera data analysis, you are invited to visit my poster board at number 114 at the poster room, located in the ground floor foyer of the conference center. Now, going into the model proper, we use a compartmental deterministic model of opioid use and non-fatal and fatal overdoses. And to ensure equilibrium and factor in the effects that occurred before and after the study period, the time horizon spans from 2010 to 2023. Let me quickly describe the model schematic. On the upper two compartments are the people or group of people who do not use fentanyl. The lower two compartments represent the group of people who use fentanyl. The compartments on the left represent the population who have not experienced overdose in the past 6 months. And on the right, we have the population of people who have experienced overdose in the past 6 months. People can enter the model when they start injecting drugs, and they can exit in three major ways. The first is when they stop injecting drugs. The second is if they die from causes different from fatal overdoses, or if they die from fatal overdoses. People can also move between the compartments, for example, when they experience a non-fatal overdose, or if it has been more than 6 months since the last time they experienced an overdose. They may also transition from non-fentanyl drug use to fentanyl drug use, or vice versa. We also factored in the experience of repeat non-fatal overdoses within 6 months of the first experience of an overdose. We factored in the risk of dying after a recent non-fatal overdose, and we also factored in the higher risks of dying among those who use fentanyl. On this table, you will find the key, descriptions of and symbols of the key model parameters we use for our model. And I've discussed, many of the parameters earlier in the model schematic, but just to emphasize that the model use a time-varying relative risk of experiencing non-fatal overdoses in the last 6 months. So for our model, we sampled 1,000 parameter sets of the prior distributions, and we fitted our model to fentanyl use prevalence in the La Frontera study, which is 51% in 2020 to 2021, and then 62.4% in 2024. We also fitted to past 6 months experience of non-fatal overdoses among those who use fentanyl, and also to non-fatal overdose among those experience of non-fatal overdoses among the participants who do not use fentanyl, as shown on the table. We also fitted to the overall mortality rate in the La Frontera data, which is 0.095 per person year. And then we perform a least square calibration on each of the 1,000 parameter set. And this is the output from the model fitting. The black lines represent the non-fatal overdoses, 1,000 run of non-fatal overdoses in the population of people who use fentanyl. And the red line represents the experience of non-fatal overdoses in the population of people who do not use fentanyl. Despite the noise and variability you see on this plot, the fitted trajectory still demonstrates the model's ability to replicate observed overdose data in the study. For the modeling analysis, we estimated the population level fatal and non-fatal overdoses using the time-varying relative rates of overdoses associated with fentanyl. We then did a counterfactual analysis, setting that relative rates to 1 for 3 parameters where fentanyl were used. The first is the experience of non-fatal overdoses among those who use fentanyl. The second is the experience of repeat non-fatal overdoses among those who use fentanyl. And the third is the experience of fatal overdoses among those who use fentanyl. We also estimated the population attributable fraction of non-fatal overdoses by subtracting the overdoses in the counterfactual scenario from the overdoses in the baseline for the 1,000 run. And we repeated that process for fatal overdoses. And this is the finding of the analysis. We found out that about 130,000 non-fatal overdoses occurred between 2020 and 2024. Overall, 91,000 of them are attributable to fentanyl use, which implies that 70% of the overall non-fatal overdoses could have been prevented if there were no fentanyl in the drug markets. Similarly, the deaths attributable to fentanyl were 744, implying that about half of the overall fatal overdoses could have been prevented if there were no fentanyl in the drug markets. Our study has both strengths and weaknesses. The strength lies in the fact that we leverage local longitudinal cohort data to inform our modeling. We also noted that recent non-fatal overdoses are predictors for subsequent fatal overdoses. We therefore modeled the effect of recent non-fatal overdoses on experience of repeat non-fatal overdoses and also fatal overdoses. This type of modeling analysis is not very common in the literature. Also, we implicitly accounted for the effect of nalozone in the mortality estimation. We recognize that our study has some limitations. The model sample size of 204 participants in the La Frontera study limited the statistical power and contributed to uncertainty in the parameter estimate. Due to this small sample size as well, we had limited ability to disaggregate our analysis by key factors such as incarceration and homelessness. Also, because self-reported data use, we understand that parameters might be subject to social desirability or misclassification biases. In conclusion, our model highlights the preventable burden of overdoses associated with unregulated drug supply and calls for the expansion of drug checking services and the introduction of safe supply interventions. Our study provides a model-based data for evidence-driven policy making, and also a modeling framework that can be used in other settings to assess the risks associated with unregulated and adulterated drug supply and evaluate overdose prevention interventions. We acknowledge La Frontera study participants who provided useful data for this modeling. I also appreciate my supervisors, Dr. Natasha Martin and Dr. Hanik. Funding for this study were gotten from, and also the researchers who participated in this study were derived from NIDA, NIH, and also the San Diego Center for AIDS Research. If you would like to know more about our research or connect with me, you can scan the QR code or also send me an email. Thank you very much for your time, and I welcome your questions and comments.